Good morning. I'm Bonnie Gardner. I'm co-chair of the Public Affairs Forum of the First Unitarian Universalist Church. Welcome. We hope you'll attend our forums. They are most Sundays at noon at our church at 4700 Grover Avenue. For more information, go to our church website at www.austinuu.org. Our forums are free and open to the public. And now I want to ask Peggy Morton, who is the chair of our Social Action Committee, to introduce today's speaker. Peggy?
Thank you, Bonnie, and thank you all of the Volunteer Forum Committee workers who bring us informative public speakers weekly. I want to give you extra props today for bringing Brittany Yelverton to us, who is with Planned Parenthood, Texas. I, along with fellow UU social justice activists, first met Brittany a little over a year ago, as she came here to teach us about political advocacy, specifically with our Texas legislators, and talking about or advocating for women's health care, family planning, and reproductive justice, which includes legal abortion. Throughout the regular session, Brittany sent us action alerts to get to the Capitol whenever the House or the Senate was having a hearing about our causes. We ran up there many times during the regular legislative session to either support good bills or to register our opposition to bad bills. Some of us wrote letters to all the committee members, and some of us actually went to the mic and testified personally. At the end of that session, we actually ended up celebrating the fact that we had stopped 19 bad abortion bills. But then those special sessions started happening, and the rules changed. And as you know, throngs of Texans pounced on that Capitol. And many of us were wearing our pro-choice orange, but others were wearing blue. And one of my favorite anecdotes about Brittany was one morning we were lined up to get into the gallery. And a man wearing blue came walking up to Brittany. And one of her friends said, "Oh, here comes your friend." And Brittany smiled and looked at him and said, "I love this guy." And the man handed her his business card. And he said, "I have learned so much from you. And I really hope that we can sit down and have coffee after this is all over with." Now, to me, that depicts a woman who knows how to cross political borders and keep conversation going. And it is a great honor to me to introduce to you today my friend, the inimitable, invaluable humanitarian, Brittany Yelverton.
Hello, everyone. Thank you so much for being here this morning. I want to thank Bonnie and Peggy for such a wonderful introduction, and I want to thank you for being so kind to attend and to listen a little bit about what's going on in the state of Texas when it comes to women's reproductive health care access. As they mentioned, I work with Planned Parenthood of Greater Texas. We are based here in Austin, Waco, Dallas, and Fort Worth, and kind of that entire area on I-35 in between. And I am the community outreach specialist, so I work in the public affairs department and do a lot of work with community outreach, engagement, and political advocacy. So today I'm specifically going to be talking to you about a little bit about the 2013 legislative session and the special sessions. But I also want to give you some context about what happened in the 2011 legislative session that's really kind of helped paint the picture when it comes to women's reproductive access in this state. And I'm going to end with some steps forward and kind of where we are in litigation and what we can anticipate as a community when it comes to women's reproductive health care access. Really quickly, just some background on Planned Parenthood. So we are a nonprofit healthcare provider, and our mission is really unique because it's three-pronged. The first kind of pivotal aspect of who we are as a nonprofit healthcare provider is that provision of quality, affordable, compassionate, and non-judgmental healthcare. That's absolutely critical to who we are as a provider and as a nonprofit. It does not matter to us whether someone is insured, uninsured, documented, or undocumented. We fervently believe that every single individual has the basic human right to access quality, affordable health care. And so we provide that to people in our community of all genders, all ages. The second kind of pillar of our mission is really a focus on quality, medically accurate sex education, which, as we know as Texans, is often pretty difficult to come by in our public school system. Many of the majority of Texas public schools operate with an abstinence-only sex ed, which once again does not provide young people with information in terms of being able to make quality, informed, wise decisions about their sexual and reproductive health. The Gates Foundation actually did a study that kind of determined what the impact of teen pregnancy was on young women, and found that the impact that it has on a young woman's economic future and educational outcomes is incredibly dire. Over 1/3 of the young women that drop out of high school consider teen pregnancy one of the major factors for that decision. And so for us as a state not to provide medically accurate, comprehensive sex education is actually doing a huge disservice to our young people. Here in Texas, I'm very, very sad to report, we are in the top 5 states in the nation with the highest teen pregnancy rates. That being said, I think what is more shocking is that we are number 1 in this nation for repeat teen pregnancies. So not only are we not engaging with our young people initially, giving them, proper medically accurate education about their reproductive and sexual health, but they're falling pregnant and we're failing to reach out to them again. And they're having a second teen pregnancy. So as I mentioned, kind of the impact that this has on their educational outcomes and their economic future is really, really, really a challenge. So we, as a nonprofit, actually provide that comprehensive, medically accurate sex education in our community. We are so incredibly fortunate to have some really great partnerships in and around Central Texas. We partner a lot with Austin Independent School District, private schools, different nonprofits to provide this education. Not only do we work with young people, but we actually work with parents, which I think is pretty pivotal because we provide parents with the support that they need to begin that open and honest dialogue about sexual and reproductive health with the young people in their life so that they have some background and they have some support and just some tools to do that. We also have bilingual programs, which is really wonderful and really kind of foundational to the inclusivity that we hold dear as an organization. So that's the second prong of our mission. The third prong is where you all come in, and this is the advocacy portion. And this is when we just fight to make sure that this healthcare remains accessible and this education remains accessible to all people. And so that kind of takes the form in writing letters to your legislator, voting, showing up for hours at the Capitol to make sure that you are engaged in the civic process and that your voice is heard and your voice matters. And so I just want to thank really our community and the community across the state, because as we'll talk about in a few minutes with this 2013 special sessions, Texans really, this was a moment that created a movement, and that's actually what this presentation is titled, is Reproductive Justice in Texas and How This Moment Became a Movement. So I would like to take you through this. And like I said, I'll be providing some context around 2011 legislative session, which really sets the stage for reduced access to comprehensive reproductive health care. And then I'll be talking a little bit about what we can anticipate in the future. So, how did we get here? Never in my life did I think I would see a pair of exercise shoes and feel any kind of enthusiasm. Normally this is very off-putting for me, but this is so emblematic of what not just one individual did, but what a whole movement of us accomplished over the summer. I will say this, in Texas, as someone who's really part of a progressive reproductive justice movement, your victories are very few and far between. So to have not only a victory, but such a huge victory in the 2013 session, during the special sessions, I think changed the course and the trajectory of this state and of women's healthcare access and of this movement. So I'm very excited to talk about how we got here. But as I said, that's really kind of rooted in a lot of what's been happening the last couple of years when it comes to these very, very kind of strategic and unyielding attacks against women's healthcare access. So very quickly, let's talk about the 2011 session, because that is when I think we saw numerous very, very dire outcomes for women's healthcare really start to take place. In 2011, there was a really, really wonderful family planning budget that had literally existed in the state of Texas for over 4 decades. It was helping to fund, especially low-income women, get access to reproductive health care services, which included well-woman exams, breast health screenings, cervical cancer screenings, birth control. I mean, really, really important fundamental preventative care, which is often life-saving. These funds helped to make our communities and our families healthier. And so at the beginning of the 2011 session, we've had this 40-year partnership, with the federal government, drawing down dollars to really build up our family planning budget and resources. And we had a budget of $111 million, which is pretty wonderful, especially in a state with so many uninsured women. In 2011, a bill was passed which reduced the family planning budget by 2/3. We went from having a budget of $111 million down to $38 million. This was a drastic cut, and literally, I am not kidding when it felt like it happened overnight. So as you all know, here in Austin, we have 3 Planned Parenthood health centers. We have our North Health Center, our South Health Center, and then we have our health center downtown, which is at East 7th and Chacon. It has been in that building for almost 40 years now. We lease it from the city for $1 a year. It is literally one of the foundations of this community when it comes to healthcare access. We were told and given 4 days notice when this budget cut was approved and this piece of legislation passed that our downtown health center was going to lose $500,000 in funding and was essentially going to have to shut its doors. This is a health center that serves our community, the people that are low income, people that are highly vulnerable, undocumented citizens, residents, people who are in need of these, once again, life-saving preventative care, and to have $500,000 with 4 days notice kind of just given to us as something that was just going to become a reality for the women and the families in this state and in this community specifically was horrific. So I think that we did, as Planned Parenthood, what anybody would do. We panicked. When you lose $500,000, you just panic a little bit. I cannot even fathom that. And then we did what you would do next, and we called on our friends. We called on community members. We called on people in and around Austin, and we said, this is what we're up against. This is what's going to happen. We're going to have to shut the doors to this clinic potentially, and this is going to have a dire effect on our community's health. And within 6 weeks, I kid you not, over 900 unique individual donations from people in and around Austin poured in, and we raised back all of that money. So when I talk about advocacy on the ground and how you all are the reason that we even exist, I am not being hyperbolic. I mean, you saved a health center and you continue to allow us to provide life-saving treatment for people that we care about in this community. So I'm happy to say that our downtown health center is still open. But we saw the fallout from these huge budget cuts. I mean, losing two-thirds of a budget and then trying to kind of recover from that is incredibly, incredibly challenging. Not only did they cut the budget by 2/3, but then the legislature also implemented this tiered system. And it was a 3-tiered system. So with the remaining 1/3 of the budget, the way it was allocated was as follows. If you were in Tier 1, which was like federally qualified health centers, you got the majority of the 1/3 of the budget that remained. Tier 2 were individual or private healthcare providers that provided usually primary care, preventative services, but also had a family planning component. So family planning was not their main priority, but it was one of the services they offered. They were considered Tier 2, and they got pretty much the remainder of the 1/3. Tier 3 was saved and allocated for healthcare providers that really were considered specialty healthcare providers that focus primarily or solely on family planning. So you can imagine that that's exactly where our Planned Parenthood fell. We were considered Tier 3, and this is when we realized that we would be getting $0 from the state of Texas. All of this this support and this great kind of social safety net, which had taken 4 decades to build, the rug was literally pulled out from underneath women in the 2011 session when it comes to this family planning budget. And so once again, with the word that we were going to lose $500,000, we reached out to you all, and the response and the support was, I think, unparalleled and unimaginable. Unfortunately, because of these budget cuts, we have seen over 70 health centers in the state of Texas close. Many of those have been in rural areas or areas that primarily serve low-income women and women of color. The medical home of so many people in the state is gone. It's just gone. So you have over 70 health centers closing. Only a fraction of those are Planned Parenthood, but still so incredibly, I think, devastating for our organization and for our patients who have trusted us, many of them for years. But then you also kind of see a ton of clinics and health centers are having to reduce hours drastically or having to lay off staff. So, thousands and thousands and thousands of women in the state are now going without health care because of these politically motivated attacks. So as you can see, the final cost of these cuts resulted in $231 million to the state of Texas. 284,000 women are projected to lose services entirely. So once again, not being able to access your well woman exam, breast health screenings, cervical cancer screenings, birth control. I mean, that's not an option for a huge portion of our population now. And they're anticipating an additional 20,000 unplanned births, which is going to increase Medicaid infant and first-year costs. It's going to be burdensome to the Texas taxpayers, but it also takes family planning and the ability to plan and space your families out of the hands of many women. And the Center for Disease Control actually said that family planning is one of the top 10 kind of healthcare options and opportunities that has been ranked in the last century. So this is an actual form of health care, is hugely, hugely helpful and incredibly important to our community. And to see that just kind of lose funding is pretty tragic for our citizens and residents. 2011 was also a very, very difficult legislative session for us because we also, in addition to seeing the family planning budget completely eviscerated, we also saw the passage of the mandatory sonogram law. And this law is incredibly, incredibly burdensome for a couple of different reasons. First, what the sonogram law necessitates is that a woman who is seeking abortion care services must come to a health center 24 hours prior to the abortion care, and she must undergo a sonogram, and it is mandatory. Not only do you have to undergo the sonogram, but the heartbeat of the fetus has to be made audible. You have to be shown a visual, and you then have to be read a script. The script has no medical information that is more helpful or beneficial for the woman. It doesn't provide any insight or information that she has not yet received from the healthcare practitioner. It is simply put in place to stigmatize and shame her for the decision that she has made. It is not medically necessary, nor is it medically relevant. But it is law. It's part and parcel of what this sonogram bill required. The other thing that I will say, which is kind of mind-boggling to me, is if a doctor does not comply with the mandates of the 2011 sonogram law, so if the doctor does not make the heartbeat audible, the visual, seeable or visible, I suppose, and if the script is not read, the penalty for the medical practitioner is loss of medical license. So once again, I mean, it's incredibly, it just is mind-boggling to me. It's not a fine or a penalty. It's literally you are no longer a doctor because you have not complied with this politically motivated piece of legislation. The other thing I will say about this bill, which is incredibly troubling for me, is that it places an undue burden on low-income women and women that live in rural areas. Because if you have to come in 24 hours prior to the actual abortion care service just to have the sonogram, which means you now have to take not 1 day but 2 days off. You have to find 2 days of transportation. You have to find 2 days of child care. This becomes something that many women cannot even fathom when it comes to their financial abilities to take 2 days off of work. I mean, the choice to have a medical procedure that you see is best for you, the cost that this incurs with this extra day of travel is often going to be the difference between a woman being able to pay rent versus having this medical procedure, or put food on the table for her family versus seeking the help that she needs. And so this law, I think, once again, just kind of really undermines women's autonomy and agency and takes this very personal medical decision out of the hands of a woman and her family. And it kind of just makes it something that is no longer even something that she has access to in many cases. And once again, disproportionately, just as the family planning budget cuts disproportionately affected low-income women, women of color, and women in rural areas, this bill did the exact same thing. So that is kind of what 2011 looks like. I always feel this is incredibly important information to gain, and I think this really gives you a context for what is going on in the state and why it feels, I think, so frustrating often as a woman or an ally of women's health. So I always kind of feel a little bit like the bearer of bad news. I feel like I come into a room and I'm like, let me depress you all for 25 minutes. But it is a really, really great context to have to kind of understand how we got to this point in the state of Texas. I want to transition from the 2011 legislative session and talk to you a little bit about 2012. So as you know, the Texas legislature only meets every other year. But 2012, I think maybe we thought we'd have like a time to breathe and recover and kind of address the issues of the 2011 legislative session. But what we saw was another really egregious attack against women's health care access. So I want to talk to you a little bit about the Women's Health Program. This was a program that was piloted in 2007, and it was a federal-state partnership. It provided health care, so specifically well woman exams, this important annual exam that provides cancer screenings, provided birth control free of charge to women. And there were 4 criteria for being eligible for this program in Texas. You had to be between the ages of 18 and 44. You had to be below 200% of the federal poverty level, which as an individual is around 22 or 23,000. You had to be a documented resident, and you couldn't be pregnant. If you met those 4 criteria, congratulations. You are now eligible to be in the Women's Health Program. You're going to get your free well woman exam. You're going to get free birth control. And for the first time, probably for a lot of these women, you are going to have a medical home. And this is incredibly helpful because if you think of women that fit that category, it's often, young women, women in school, women working 2 part-time jobs that can't get health insurance from, their employers. So this is an incredibly powerful program. It actually insured about 130,000 Texas women, which is fabulous and phenomenal. Planned Parenthood, even though we only represented about 2% of the healthcare providers in the Women's Health Program, saw nearly 50% of the women who were enrolled in the Women's Health Program because we were a trusted provider and people knew who we were, and we were very accessible and very, once again, women's reproductive health care that's our bread and butter. That's what we are experts in. So the other thing I will say about the Women's Health Program, not only was it a great program because it provided so much health care coverage for women, but for every dollar that the state of Texas put into the Women's Health Care Program, the federal government put in 9 matching dollars. This is one of the largest matching grants that you can get. This 9-to-1 grant is huge. So Texas taxpayers were saving a ton of money for a program that was vastly benefiting their populace. Once again, it was really a fabulous program. Started in 2007, set to fully implement from a pilot program into a fully run state-federal partnership program in 2013 in January. In 2012, Governor Perry instituted what he titled an abortion affiliate ban, which essentially said is that if you were a healthcare provider providing women in the Women's Health Program with healthcare coverage, and you were at all affiliated with abortion care provision, you could no longer provide that healthcare coverage to women enrolled in the WHP. You would essentially be kicked out of the program. You could no longer be a provider. This new abortion affiliate ban rule targeted one healthcare provider and one healthcare provider only, and that was Planned Parenthood. So we obviously fought it, and we said, this is incredibly unfair. You cannot tell a woman who she can and cannot choose as her healthcare provider. And the federal government backed that up and said, no, you are not allowed to tell a woman she cannot seek services with a qualified healthcare professional. And the federal government told the state of Texas and Governor Perry, if you continue forward with this abortion affiliate ban and you kick Planned Parenthood out of the Women's Health Program, we're going to pull all of our federal funding. That 9-to-1 matching dollars is going to be gone. And Governor Perry's response was, that was fine. Texas will pay for it itself. So, January 1st, 2013, we transitioned from the federal-state partnership of the Women's Health Program into the Texas-run, fully implemented Texas Women's Health Program. Initially, when we were the federal-state partnership, the cost to Texas taxpayers was about $4 million for this program. It is now $30 million to run the Texas Women's Health Program. Planned Parenthood is no longer allowed to be a provider in that program, and it's actually serving far less women than it did before. So once again, this kind of ruse that that our legislature is passing bills to protect women's health and to increase safety, when what we're actually seeing is that fewer women are having access to these preventative services. It just seems very, very, I think, frustrating for advocates to hear these messages and to see the actual impact and effect that it has on our community members. There's fiscally, just if we're talking about fiscal responsibility, not responsible to pay far more for a program that serves far less people. So that's kind of another attack that we saw before the 2013 session, which really kind of set the stage. I want to talk about why the family planning funding being eviscerated and the kind of complete disintegration of the Women's Health Program is so incredibly, I think, troubling here in Texas. And that is because this state has the highest number of uninsured women in the entire nation. 30% of Texas women are uninsured. Once again, this is not a place where Texas wants to be the number one spot. This is not a place we want to be winning. Recently, we kind of heard that not only are we number one in terms of uninsured women, in general population, Texas has the most uninsured people in the entire nation. So to have those kind of statistics and then to continuously deplete the healthcare access and the social safety net that exists, I think is just really, really troubling. We also have we're in the top 5 for rates of cervical cancer in this state. It's approximately 19% higher in Texas than it is compared to the national average. And the deaths from cervical cancer are 21% higher in Texas compared to the national average, which is why preventative screenings are so incredibly necessary and should really be something that we should be doing more to support the expansion of that access as opposed to restricting it. So as you can see, an estimated 1 million women between the ages of 20 and 44 in the state of Texas are in need of family care and preventative care and family planning services. So we are, when I say that we're in a public health care crisis, and specifically when it comes to women's reproductive health care, it is truly, I think, felt by our community. So let's go ahead and transition really quickly to 2013 legislative session. As Peggy kind of mentioned, we had a huge number of supporters during regular session who were coming out, registering their opposition to bills that were really harmful, and supporting bills that were really going to help improve and increase access to reproductive health care services. 2013, I think everybody at Planned Parenthood was kind of like on pins and needles waiting because we had such a bad and I think challenging and troubling experience in the 2011 session. You get scared for the state of your patients and the state of women in this nation or in this country. In the state, when it comes to what kind of bills pass or often are posited forward in the legislature. However, 2013 during regular session actually ended up not being incredibly, I think, horrific for us. We did see a little over 40 anti-women's health bills or anti-abortion bills filed, but not one of them made it to the floor of the Senate. So, it was pretty, I think, miraculous that we'd been able to kind of fortify our allies in the different houses to make sure that these really, really egregious bills were never able to actually gain any legitimate traction towards becoming law. So you see, like in the Texas Tribune, kind of these great headlines, which we really loved reading for the first time in a very long time, that there seemed to be a bipartisan truce. Lawmakers were putting down their swords. They weren't going to go after women's health this session. They were going to kind of take a step back and focus on other issues kind of affecting our constituents. So as I said, not a single anti-women's health bill made it to the floor of the House or the Senate during the 2013 session. And that was because of this 2/3 rule. And what the 2/3 rule in the Senate does is it blocks legislation that doesn't have a 2/3 majority kind of support from actually being able to be considered on the floor and then be posited to be put forward into law. So we kind of had that protection during regular session. However, after regular session ended, Governor Perry called a special session. And for the first 2 weeks of that special session, abortion was not on the call. So for something to be on the call, that means that legislation can now be filed that is related solely to that topic or to that kind of area. So initially in special session, you had transportation and redistricting and juvenile justice on the call, and abortion was nowhere to be seen. So we all kind of like breathed a sigh of relief, and we're like, okay, we're not on the call for special session yet. And the first week passed, and abortion had not been placed on the call. And the second week passed, and abortion had not been placed on the call. And I think we were all kind of feeling a little bit better. You're always a little bit nervous in Texas as a reproductive justice advocate. You're always a little bit kind of just waiting to see when the other shoe is going to drop. But we felt pretty comfortable. And then of course June 11th rolls around. Governor Perry expands the special session call and includes abortion. And this is when we see all of those 40 anti-women's health bills that kind of had appeared but never gained traction during regular session. We see those refiled for special session, and they can now be considered. And so in the regular session, as you have this two-third kind of blockade majority rule which exists that says two-thirds of the Senate has to support a bill before it can even be considered on the floor. You don't have that in special session. I kind of equate Texas legislature's special session to the Wild West, where it's kind of like no rules, like everybody's just kind of guns blazing running in and kind of just filing legislation willy-nilly, really. And so we see the resurfacing of these anti-women's health bills and these anti-abortion bills. I want to talk to you really quick about the bill that gained traction and has unfortunately, as we'll talk about in a little bit, became law. Because there were so many bills that had been built out around anti-abortion measures, the authors decided to make an omnibus bill, which is kind of almost like a catch-all bill. And it had 4 primary provisions in this bill. It was originally Senate Bill 5 in the first special session, and then was filed in the second special session and was passed into law as House Bill 2, which is currently what we have standing in the state of Texas. But really quick, I want to go over the 4 provisions of Senate Bill 5/House Bill 2 with you, which is this anti-choice or anti-abortion omnibus bill. The first provision in this bill bans abortion after 20 weeks. There are no exceptions for rape or incest. It's just a complete ban. So that's the first provision. The second provision is on admitting privileges, which I think a lot of times when people initially heard that, it didn't seem like too dangerous of a provision to be put on a bill because people didn't realize kind of the impact that having the requirement that physicians who perform abortion services have admitting privileges to a hospital within a 30-mile radius of where they perform those services. So that's what the second provision mandated. The reason this is so problematic and kind of difficult to deal with is because oftentimes, to even gain admitting privileges as a physician, you have to agree with the hospital that you're going to admit a certain number of patients to that hospital in the course of a calendar year. Abortion care providers and physicians cannot make that promise because abortion has such a low rate of complication, which is something that is very, very important to us in terms of keeping abortion safe and legal, that we as abortion care providers and physicians very, very rarely ever admit anyone to a hospital. The second kind of provision that could be included to even be considered for admitting privileges as a physician is that you have to, potentially in some areas, you have to be a resident of that county. Well, for a lot of our physicians, they actually have to travel because they don't live in the small towns where they provide abortion services. They take time out of their schedule, or they leave their own medical practice to travel in to provide that care to that community. So they wouldn't even necessarily be able to be considered for admitting privileges because they're not a resident of that county. The other issue you have with this admitting privileges piece is that oftentimes, if you're an abortion care provider, potentially the only hospital within a 30-mile radius of where you practice could very well be religiously affiliated. And that sometimes it's much harder to gain admitting privileges, as a provider of abortion services, if the hospitals around you are all kind of religiously affiliated. That can be a really big challenge. And so that also, I will have to say this, admitting privileges take a very, very long time usually to gain. It's not something that happens overnight. Sometimes, boards will just meet quarterly. And so this kind of provision that if this law is passed, doctors have to have admitting privileges to provide abortion services, and any doctor that doesn't have those admitting privileges has to cease services. Is actually really, really burdensome. The third provision, so we have our 20-week ban, we have our admitting privileges requirement. The third provision talked about the dispensation and dosage of medication abortion. So this was problematic for 2 reasons. It necessitated that for a woman to be able to access medication abortion, that it had to be administered according to the final printed label of the FDA-approved drug regimen, which, as evidence-based protocol kind of changes over time, dosages decreased because it was actually a safer standard of care for women. this part of the bill would not allow doctors to use evidence-based protocol. It would mandate that they use final printed label of the FDA approval of that original kind of medicine. We see that that's very, very different. So aspirin is often used as a regimen for heart health and to prevent heart attack. That's not what it was approved for, but evidence-based protocol has shown that that's actually a really helpful benefit of this medicine. That kind of takes that kind of evidence-based protocol away and out of the hands of physicians and says you have to just go according to what was approved almost 20 years ago. Additionally, with the medication abortion provision, it would require 4 separate trips for a woman to gain these services. She would have to come 24 hours in advance for a sonogram. She'd have to then come 24 hours later for the first dispensation of pills. She'd have to do a 3rd appointment for the 2nd dispensation, and then she'd have to come a 4th time for a follow-up. Once again, if the closest abortion care facility to you is 87 miles away and you are a mother who works 3 jobs and you have children, this becomes a non-option. This idea of access doesn't exist for a huge portion of the people in the state. And then the 4th kind of provision, this bill, so the 20-week ban, the medication abortion provision, the admitting privileges requirement. The 4th is the requirement that by 2014 in September, all abortion care facilities must comply with the regulations of an ambulatory surgical center. This is something we'll talk a little bit more about in a few minutes. But essentially, to be an ambulatory surgical center, the requirements are as follows. You have to have certain HVAC systems. You have to have certain overhead lighting. You have to have certain widths of hallways and of doors. You have to have a separate changing room for men and women. And so this is kind of one of the, I think, really problematic aspects of the bill is that abortion care facilities don't meet these standards because, I mean, it's not an incredibly invasive procedure. It's already so highly regulated and so incredibly safe that to renovate your care facilities to an ASC, on average can cost a projected $300 a square foot, which is cost prohibitive for providers. And so these are the 4 kind of provisions that exist. Really quickly, I want to take you now to the more exciting part of this presentation where it's a lot more inspiring and I think uplifting. And that is, this bill was filed, people heard about it, and things started to change. So usually, at hearings you have 20, 30, 40, 50 people maybe show up and register their position or testify. When we heard that this omnibus bill was going to be heard in the House State Affairs Committee hearing, myself and quite a few other organizers from the reproductive justice movement in the state of Texas got together and we said, how cool would it be if we could turn out like 200 or 300 people and we could stage like a citizens filibuster? Like we could run out the clock or we could just, make the hearing go on until 4 or 5 in the morning and they'd have to reconvene another day. Because think of this, we are already 2 weeks into this special session, which means we only had about 2 weeks left. And then any kind of bill that has not been passed essentially dies. So we kind of knew that we had time on our side a little bit, but we didn't know kind of the response we would get from our community. So we just kind of said, okay, you know what? Let's be super optimistic. Let's aim for like 200 or 300 people to turn out to this hearing. They'll register, they'll testify. We'll really show our legislature that we're paying attention and that this is not the will of the people. This really invasive, medically unnecessary, omnibus bill. So we put the call out, hoping for 300 people. That night, we get 700 plus people in the little bitty John H. Reagan building at the House State Affairs Committee hearing. And it was unprecedented. People were sitting in the hallways eating sandwiches. People brought like cookies from home. We started getting pizzas delivered at 2 or 3 in the morning from like California, and like a dude named Jerry in Jersey was sending pizzas, and people who were hearing about it using social media. So literally, I think it was at maybe 1 or 2 in the morning, Chairman Cook made the comment that he was going to have to cut off testimony because it was becoming too repetitive. The stories and the testimony were too repetitive, and that he would allow for 1 more hour of testimony, but that would leave about 200 people who had registered left unheard, which doesn't happen. This is your government, this is your voice, this is your time to become civically engaged. You are supposed to be heard. And so obviously the room got very upset. We felt as if we were just being silenced over decisions in healthcare, about our own bodies and our own lives. And so one of our young advocates, Leslie, made the comment as soon as they had the last hour of testimony kind of reignited. She took to the podium for her testimony and she said, our stories and our testimony are not repetitive. what is repetitive is your attacks against women's health. And so I think that was one of the pivotal moments when we were like, we have power here. We have power and we have agency and we have got to engage and we've got to make sure that we are heard. So unfortunately they cut off testimony at 3:30 in the morning. 200 people had not been able to testify. We had 700 people show up. And I will tell you right now that is the smallest number of people we had show up for the remainder of the special sessions, which is phenomenal. So as you can see, I'm going to take you through some pictures. This is the more uplifting part of the presentation, y'all. You did very, very well during the very depressing section. The number of supporters began to kind of take off with thousands of people, and they were all wearing orange. That was kind of one of the big, I think, visibility indicators that different reproductive healthcare organizations and organizers decided we're going to come unified and we're going to look like a movement. And so we all just showed up in our orange, and I think the tagline was like, "Come early, stay late, wear orange." On June 23rd, as the full House debated the amendments on the omnibus bill, we've heard some pretty unfortunate comments and commentary from different legislators. This is one of the comments from Representative Laubenberg, who made the following comment during the bill hearing, saying, in the emergency room, they have what's called rape kits, where a woman can get cleaned out. So once again, the lack, I think, of genuine knowledge about women's health and why these bills are being drafted and what we hope the impact is, often I think can be questionable or seems to be a bit lacking. So we had to change some things. We had to update some numbers. It says there are 0 days without a GOP rape mention. So, and that's unfortunately, we see these attacks happening nationwide. This is not just specific to Texas. On the 24th, which was the House floor debate and vote, despite being outnumbered for the vote, House members opposing the bill were able to debate until very, very early in the morning because they had come up with so many great amendments. And this is when we realized this becomes about running out the clock. This becomes about getting tons of people there, registering tons of people to provide testimony, and really, really running out the clock on this. So because, even though we knew it would pass in the House, because we did not have the sheer number of votes to defeat this bill, being able to eat up that time delayed it being able to go onto the Senate floor and have the debate and the vote taking place there. So really quickly, on 11:18 a.m. on Tuesday, June 25th, State Senator Wendy Davis began the filibuster to motion to concur with the House version of the bill. Her filibuster was going to be a little over 11 hours. Really quickly, the rules of filibustering in the Texas legislature are as follows. You cannot sit. You cannot lean against anything. You cannot eat. You cannot drink. You cannot go to the restroom. 11 plus hours she was going to do this. You also cannot receive any assistance from any of your fellow senators, and everything you say has to be germane to the bill. It has to be completely on topic. And this is what Senator Davis was up against, but she was willing to do it. And it wasn't just her. Senator Vanderpeet was willing to do it, Senator Watson. A lot of our really strong, phenomenal leadership really kind of stepped up. And so she began the filibuster. We had over 20,000 people tune in to the live stream for the Texas Tribune, which was unprecedented, I believe. People were just emailing us and tweeting us and sending us pizzas. It became a national or worldwide trending topic on Twitter. And this man you might be familiar with, when President Barack Obama tweeted that something special was happening in Austin tonight. So people were taking note. And so this is when it becomes not just about a moment, but a movement. And not just even something necessarily in Texas, but something happening across our nation. This is the night of the filibuster. There were over 3,500 people in the building that night. Some of you all are in the audience and were there. The doors to the Capitol were locked because it was at capacity, which I did not even know was feasible for that building because the building is huge. There were people lined up outside of the Capitol trying to get in. It was beautiful. It was, I think, the most stunning experience I've ever had in my life. And something I think we haven't seen in the state for a very long time, but I don't think it's going anywhere, this momentum and this passion and energy. I'm going to be wrapping up in 2 minutes. I'm so sorry. I get very excited, and I tend to talk a lot about this. So we had the filibuster. We had Leticia Vanderpeet's amazing quote, which she said, "At what point must a female senator raise her hand or voice to be recognized over the male colleagues in the room?" And that is when the people's filibuster started happening, and we essentially yelled and screamed to run the clock out, to essentially essentially push the voting period over midnight so that the bill would die in session. And that's exactly what happened. People who had been sitting in the gallery for over 12 hours in silence started yelling, so a vote couldn't be taken and there was no audibility there. We have some of our amazing advocates who were there that night. We just kind of want to mention Miss Ann McAfee, who's been phenomenal in terms of her support for women's health. And that is what happened, is we ended up killing the bill, which, once again, as I said, victories in Texas are few and far between, and you have to take them when you get them. And for it to be such a huge victory that the vote wasn't able to be taken and that bill did not pass during the first special session was phenomenal. Of course, that was like a very short-lived victory, because the next day, Governor Perry called a second special session, immediately put abortion on the call, which meant they had 30 days, which meant time was not on our side. We still rallied. We had a rally the next day at the Capitol. Over 7,000 supporters showed up. It was amazing. We had, phenomenal speakers just talking about the state of women's health care and kind of the movement forward. Unfortunately, as I said, because time was not on our side in that second special session, the bill did pass. It was signed into law on July 18th. This is my last slide, and this is where we are now. So right now, 3 of the provisions are in place. 3 of the provisions have become law in the state of Texas, and that is the 20-week ban, the medication abortion restrictions, and the hospital admitting privileges. As you know, Planned Parenthood, along with many other reproductive health care providers, the Center for Reproductive Rights, and the ACLU, and independent abortion care providers filed suit. It was Planned Parenthood v. Abbott. And we went to the district court, and an injunction was given to kind of prevent the admitting privileges piece from going into effect. Unfortunately, Greg Abbott's team filed an emergency appeal, and the Fifth Circuit Court stayed the injunction, which means that right now those 3 provisions have been enacted and are in place. It's been challenging for abortion care providers because many don't have admitting privileges. And so we've seen the closure of some clinics or the stay of a lot of providers being able to provide these medical procedure for women. And we're waiting to see what's going to happen in 2014 with the ambulatory surgical center, or the ambulatory surgical center requirements. People ask us, are we going to file a lawsuit? And we're weighing all of our options to make the best and most informed decision. But right now where we stand is we're waiting for the Fifth Circuit Court to rule on the constitutionality of the admitting privileges piece, which is what we filed suit on, as well as the medication abortion restrictions, which is what the Planned Parenthood v. Abbott suit considered. And so that is where we are. So I want to pass it over. I know that we have some questions now, and if you might have specific questions about this, I'm happy to answer those as well.
Thank you for a wonderfully inspiring talk. Any questions? Would you raise your hands high?
Hi, Bethany. My name is Jillian Redfern, and I actually have about 500 questions for you, which I'm not going to ask. But I really just want to say thank you. Lost a lot of hours last summer at flexibility in my job, and it was under your leadership and watching you made that possible. And I'm going to cry, but I want to say thank you so much for being a personal hero to me. And work hard, and we're here with you.
Thank you.
Thank you, Dylan. We have a question from Glenn Williams.
From the last slide, what about the 20-week ban? Where do we stand on that?
That's a great question. So the question was, where do we stand on the 20-week ban? We didn't include that in the court case, and so that has gone into effect. And that kind of provision that ban has been passed in other states. And so whenever we decide to file litigation, we always want to make sure that we are going to set the strongest precedent possible, that we're going to be very smart and strategic about how we challenge it. We also see other pieces of litigation that have been filed specifically around the admitting privileges portion in places like North Dakota, Mississippi, and Alabama, who've all been granted an injunction to prevent those admitting privileges from going into play because they were considered unconstitutional. And so it's kind of a patchwork effort. So we're looking at other states that are having very similar TRAP legislation, which is targeted regulation of abortion providers, filed, and we're seeing what's the smartest way to file litigation. So we didn't include the 20-week ban in the court case, Planned Parenthood v. Abbott. We just included the abortion privileges and the admitting privileges piece. But because we did not challenge that unfortunately, as of October 29th of 2013, became law and has unfortunately done so in other states as well. That's a great question, though.
Yes. I was there as the clock ticked, and we went into the next day. Mm-hmm. And the vote was taken in the next day. How do you feel about that, and what is the impact of ALEC in all of this?
The first thing I want to address, so the clock issue is really, really important and I think really interesting. And this is why I don't understand social media. I'm not super tech savvy, but I love it because I know that it's so powerful. So we had the vote, and obviously the citizen filibuster is going on. People are screaming and yelling in the gallery. There are thousands of us screaming and yelling in the hallway, trying to make it so loud that they can't hear to take the vote, and the vote cannot be called and registered before the midnight deadline. So that's happening. The official Texas legislative website says that the vote was taken after midnight initially. So, of course, people take screenshots of that, and it says that like 12:03 or 12:04 the vote was taken, which means it wasn't taken before the end of the special session, and it's essentially the bill is dead. You see maybe 2 or 3 minutes after that on the actual Texas legislative webpage that the timestamp has been changed to before midnight. So you have people holding up pictures. It went bananas on Twitter of like the timestamp that originally went up that showed after midnight the bill being passed, and the shortly after amended timestamp showing before midnight being passed. And this is why a lot of us were there in the Capitol on the night of the filibuster until like 3 in the morning, because they had not made any call as to whether or not the bill had passed. We were pretty sure the filibuster worked, but we weren't positive. And so I think that's really important to note, is that that wasn't fair. I don't know any kind of legal explanation to kind of express what happened, but to show the reality of a situation and then to amend it in a way that is unjust and not representative of what happened was incredibly concerning. So we were right. The bill did die because it was passed after midnight. I can't speak too much about ALEC and funding and legislation because I don't have a huge, broad background and knowledge base of that, but we do have people that I can connect you to that can give you more information for sure.
My name is Beth Moe, and I want to affirm that you were followed by people all over the country. We are down here. I've never been in Texas before. We're visiting our son from Minnesota, and I was watching, and I believe that ALEC has been part of it because we've also paid very close attention to the issues in North Dakota. I grew up in Fargo, North Dakota, where the only reproductive rights center is currently, and so I just want to tell you that people from all over the country, and I am pretty up on social media, and a lot of my friends from all over the country followed you guys and watched what happened that evening, and it was really super cool.
Thank you. That's awesome. Welcome to Texas, y'all. Sorry, it's kind of a bummer for women's health.
Earlier you were talking statistics about uninsured in Texas, et cetera, and then provision of women's health care services. And how is the Affordable Health Care Act, how do you foresee that helping to improve the situation?
That's a great question. So in terms of the Affordable Care Act, I think this is a great opportunity for Texans. As we know, unfortunately, Texas and Governor Perry chose not to expand Medicaid, which denied a huge portion of the population of our state from getting covered under Medicaid expansion. So that's unfortunate. But I will say that you, as a state, can opt into that Medicaid expansion at any time. It wasn't like a one-time opportunity. So states, depending on leadership or change in position, could very well expand Medicaid in the future and really help, extend coverage through that program to people. But even though Medicaid wasn't expanded here, the Affordable Care Act is, I think, going to be incredibly, incredibly helpful, because if you fall anywhere between 100% and 400% of the federal poverty level, which as an individual is about $11,900 annually in income versus $45,900 annually in income, you are eligible for a subsidy, which means you will get help paying for that health care plan, which is incredibly, incredibly helpful. It's also kind of like if you go onto the marketplace on healthcare.gov and you finish your application, it's almost like a Travelocity. So like, you can compare airline prices and times. It's like that, but with healthcare plans. And there are different increments of plans. So you have a catastrophic plan, a bronze plan, a silver plan, a gold plan, a platinum plan, which really gives you, as a consumer, a lot more I think, agency in what kind of healthcare coverage you want, how much you can afford. So I think the actual expansion of healthcare is going to be incredibly helpful. But the reform in general is phenomenal. The ACA made it, illegal to deny someone coverage for pre-existing conditions. You have the birth control mandate, which provides free birth control for women. Your annual woman exam is now covered when you have insurance free of charge with no copay. lifetime and annual caps and limits have been dispelled because of the Affordable Care Act. Also, women on average used to pay like 40% higher in premiums than men, and that gender rating has been ruled out because of the Affordable Care Act. So in terms of reform of the healthcare system, I've seen some really positive changes. But I do think that there's going to be some really helpful expansion so people that don't have insurance through their employer can now actually access a plan that fits well for them and that they have the ability to choose.
Have donations to Planned Parenthood of Texas steadily increased?
They have, and we are so grateful for it. Once I know, that is the thing. Like, I will say, this community rallies behind us like you would not believe. It is so inspirational. So we have, unfortunately, when you have funding cuts and then you're kicked out of the women's health program, and then you see these really intense restrictions kind of piled upon you as a nonprofit healthcare provider, we've felt it. We've felt it significantly in terms of our finances, but kind of. I think the light at the end of the tunnel with that is the community has been that much more responsive. And so we have seen donations increase, and people, once again, from like different states sending money to Planned Parenthood of Greater Texas or helping to fund different reproductive health care organizations in the state. I think it's been really wonderful. So we have seen increases.
Yes, hi, I'm Sarah Bork. And I think the question I have is that I'm not clear on how to engage non-believers. And I, regularly post on Facebook, and I have my little reactive blurts here and there. But I know that I'm pretty much preaching to the choir because those are my peeps on my Facebook feed. Mm-hmm. So how do we reach out? How do we cross that line? And I think for me, I get so angry about this stuff that it's a challenge to basically engage those who do not believe without getting ticked off. Mm-hmm. So I'd love a few plot points. You have a wonderful manner about you, and I'm sure you really do.
Thank you. That is very kind of you. I think my mom would disagree in terms of my ease of getting along. She's an angel. The first thing I would say is just kind of this approach of mutual respect. And even if the respect is not reciprocated on the other side's part, going in there and being respectful and saying, I understand that you have a perspective that you're coming from and that you have some deeply held beliefs and things that you value, and I can understand that. I feel the same way. I have some deeply held values and beliefs, and just having that mutual respect. And the way that I kind of frame it when I'm talking to people is that abortion is obviously a deeply personal and complex decision to make. And I fervently believe that decision has to remain between a woman, her family, her faith, and with the consultation of a medical provider. There's no room for politics in that decision. And there's no room for political maneuvering when it comes to women's health care access. And I think even in terms of Planned Parenthood, some people are very vehemently just against Planned Parenthood as an organization because they have a lot of misconceptions and they have a lot of, misinformation. But I say, safe and legal abortion is absolutely imperative to keeping our citizenry healthy. But the majority of what we do is the provision of life-saving, breast health screenings and cervical cancer screenings, and really important. We screen for diabetes, high blood pressure, anemia, high cholesterol. You want your community to have this health care support and access. And so that's one kind of inroad I use for Planned Parenthood. But then for the abortion issue, because people feel so deeply about it, and it can be such a contentious or confusing thing to discuss. It's just that mutual respect and saying, I understand and value where you are coming from, and I know that you have some deeply, strongly held beliefs, and I have those as well. And I think there is a middle ground. I really, really do. So that's kind of, I think, the approach I'd recommend.
Thank you for providing an update on one of the most important public health issues of our day. Let's give her a big hand.
Thank you.